Despite these technological advancements, aging brings about different challenges, bringing about increase in prevalence of chronic diseases such as hypertension, diabetes, arthritis, and dementia. Alzheimer's disease is the most common type of dementia and is the fifth leading cause of death among older Americans. Older adults also face more challenges with everyday living activities. 80% of older adults have at least one chronic health condition, and a third of older adults has limitations in activities such as preparing meals and housekeeping. The challenge of which would be the caregiving and the caregivers because birth rates continue to decline. This poses a potential shortfall of caregivers, and this trend will continue. Caregivers would themselves be at risk for health problems and shows that they will be working longer hours and caring for people with more than one chronic disease. So what are the programs for the health and wellness for the elderly in Philippine setting? So there is a Republic Act of Senior Citizens Act of 2003 and then expanded also in 2010, wherein health implementors are to undertake and promote the health and wellness of senior citizens and alleviate the conditions of older persons who are encountering degenerative disease. They aim to promote quality of life and continue nation building by providing focused service, delivery packages, and integrated continuum of quality care. These are patient-centered and environment standard to ensure safety and accessibility for senior citizens. They provide equitable health financing, capacitate health providers in the implementation of health programs for senior citizens, database management, strengthen coordination and collaboration with other stakeholders involved in the implementation of programs for senior citizens. The current Philippine Health Agenda guarantees that centralized health services for care in all life stages, service delivery networks, and financial risk protection, geriatric health is mentioned as an area of concern. So all senior citizens are covered by the Philippine Health Insurance Corporation by Republic Act 10642 for all senior citizens. So the vision of the health and wellness program for senior citizens would be a country where all senior citizens are able to live an improved quality of life through a healthy and productive aging. Implementation of a well-designed program that shall promote the health and wellness of senior citizens and improve their quality of life in partnership with other stakeholders and sectors. So we have to ensure better health for senior citizens through provision of focused service delivery, packages, and integrated continuum of quality care in various settings. To develop patient-centered and environment standards, to ensure safety and accessibility of all health facilities for senior citizens, to achieve equitable health financing to develop, implement, sustain, monitor, and continuously improve quality health programs accessible to senior citizens. To enhance the capacity of health providers and other stakeholders, including senior citizens group in the implementation of health programs for senior citizens. To establish and maintain a database management system and conduct researches in the development of evidence-based policies for senior citizens. To strengthen coordination and collaboration among government agencies, non-government organizations, partner agencies, and other stakeholders involved in the implementation of programs for senior citizens. Program components would include the policy, standards, and regulation component shall develop a unified patient-centered and supportive environment standards to ensure safety and accessibility of senior citizens to all health facilities and to promote healthy aging in order to prevent functional decline among senior citizens. The health financing component shall promote health financing schemes and other funding support in all concerned government agencies and provide stakeholders to provide programs that are accessible to senior citizens. The service delivery component shall ensure access of senior citizens to essential geriatric health services, including preventive, promotive treatment, and rehabilitation services from the national to the local level. The human resources for health component shall capacitate the healthcare providers in both national and local government to be able to effectively provide technical assistance and implement the program for senior citizens. The health information component shall establish an information management system and maintain a repository of data. The governance for health component shall coordinate and collaborate with the local government units and other stakeholders to ensure an effective and efficient delivery of health services at the hospital and community level. We have different partner institutions that cater to the senior citizens. There's a Department of Geriatric Services of Jose Reyes Medical Center, Institute for Aging of the UP Manila, and Philippine College of Geriatric Medicine. PhilHealth, DSWD, Coalition of Services of the Elderly, and Association of Department of Health Retired Employees. There are different policies and laws that cover senior citizen mental health and aging. Madrid International Plan of Action on Aging, Framework for Action on Aging and Health in the Western Pacific, the Constitution, Aquino Health Agenda, and Plan of Action for Senior Citizens. Republic Act 9257 is an act granting additional benefits and privileges to senior citizens, amending for the purpose of Republic Act number 7432. Otherwise known as an act to maximize the contribution of senior citizens to nation building, grant benefits, and special privileges for other purposes. Republic Act 9994 is an act granting additional benefits and privileges to senior citizens, further amending RA 7432. Different strategies are used to further take care of our senior citizens. Participatory governance for health through the life course is used, strengthening service delivery for older populations, strengthening advocacy and promotion of healthy aging, and evidence-based decision-making. Provision of influenza and pneumococcal vaccine, wellness camp for senior citizens, elderly Filipino week celebration, and Proclamation number 470, declaring the first week of October of every year as Elderly Filipino Week. WHO data says that rapid aging populations around the world from 2000 to 2050, the proportion of the world's population aged 60 years and above will double from 11% to 22%. The absolute number of people aged 60 years or over is projected to increase from 900 million in 2015 to 1,400 million by 2030 and 2,100 million by 2050. So if you're going to be a doctor, there would be more geriatric patients to be entrusted to your care. So according to the Population Institute, Diliman, Quezon City, senior citizens aged 60 and over is about 70.5% of the 2017 Philippine population. Calabarzon has the highest number, and the NCR and Region 3 follow suit. Thank you for listening. So this is our lecture on geriatrics and aging. Please subscribe to our PMCH jfsm channel for more lectures on preventive medicine and community health. Thank you.